Women who get a mammogram have more to worry about than finding cancer, and that's not finding the cancer that's there.
Some women have denser breast tissue than others, and that can affect the results. But TV5's Meg McLeod explains what you can do in a special I-Team report.
Those are the areas that the cancers tend to hide at.
It's a hidden danger that can be a deadly reality for women across the country. Breast cancer. For years, mammograms have given women the upper hand, helping millions detect the deadly disease early. But in some women, those with a certain type of breast tissue, mammograms are ineffective.
The dense breast tissue can basically obscure or hide cancers in the breast on mammogram.
Dr. Mark Ludka is the chief of mammography for Covenant Hospital's breast health program. He says about 40% of women have what they call dense breast tissue. Women's breasts are made up of both fatty and glandular tissue. The higher the proportion of glandular tissue, the more dense.
As you get more and more glandular tissue, the breast becomes lighter and lighter, and it can become more and more difficult to see through that tissue.
Dr. Ludka says that women with extremely dense breasts are more likely to get breast cancer. Tragically, 95% of women who have dense breasts have no idea.
I had a decade of normal mammograms.
That's exactly what happened to Nancy Capello, a PhD from Connecticut. Just weeks after getting the all clear on her annual mammogram, she was diagnosed with stage 4 breast cancer. She survived, but not before a mastectomy and several other painful treatments.
Do you know that dense breast tissue is very common, and there are so many women just like me whose cancers are being missed and are found at a later stage? Shouldn't you be telling women this? And the answer I got was that it's not the standard protocol, that we don't do that.
Capello has dedicated her life to raising awareness about breast density, creating a group called Are You Dense, which is fighting for laws to require doctors to notify patients of their breast density level. And just this month, Michigan became the 21st state to pass that law. Starting in June, when you get your mammogram results, you'll also get your density level.
With 1 being a predominantly fatty breast and 4 being an extremely dense breast.
So, once you know you have dense breasts and mammograms may not work for you, what options do you have? There's a new test that doctors say is more effective called automated whole breast ultrasound. Last June, Covenant's Breast Health Center was the first in Michigan to get one.
That scans the breasts in their entirety, from basically from one armpit to the other.
All right, well, Carol, let's bring your arm right up here.
The patient lies down on her back.
Is that all right for you? Are you comfortable?
The technologist then scans the breasts in overlapping vertical rows.
You're assured that there isn't any breast tissue that's excluded.
Those thousands of images are played back in a loop by the doctor who, unlike in a mammogram, is looking for dark spots.
I met that criteria to have it done.
Despite having a clean mammogram, Michelle Guzman asked to have the whole breast ultrasound.
There's no compression at all. It's very comfortable.
Doctors noticed something in her results and had her come back for further testing.
I was worried but relieved at the same time.
Fortunately, it turned out to be nothing. But Dr. Ludka urges women who, like Guzman, have dense breasts to get this additional scan.
Well, the best chance we have to cure cancer is to discover it or find it as early as possible.
The American Cancer Society recommends women 40 and older get mammograms every year. Ludka says women with dense breasts or even breast implants should get the additional automated whole breast ultrasound to rule out hidden cancers. In the studio, Meg McLeod, WNEM TV5.